Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking at this afternoon's briefing will be the following individuals: Dr. Jennifer Russell, Chief Medical Officer of Health; Honorable Dorothy Shephard, Minister of Health; Honorable Blaine Higgs, Premier of New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les personnes suivantes prendront la parole de la séance d'information de cet après-midi. La Dr. Jennifer Russell, médecin hygiéniste en chef, la ministre de la Santé, l'Honorable Dorothy Shephard, et le Premier ministre du Nouveau-Brunswick, l'Honorable Blaine Higgs. Dr. Russell.
Thank you, Bruce. Merci, Bruce. Good afternoon, everyone. Bonjour à toutes et à tous. So here we are. It's November 21st, 2020. We have come a long way since the beginning of this pandemic. And if you remember back to the very first days and weeks of COVID-19 pandemic, I think we all have some memories about what that felt like, and it was pretty tough. And all the precautions that we took early on, how careful everybody was, we made major changes and major efforts in how to keep ourselves, our families, and our communities healthy and safe. We have to do this again. All of us in every region of the province. Nous sommes aux prises avec une situation grave en raison de la résurgence de la transmission du virus au Nouveau-Brunswick. Notre situation s'aggravera rapidement si nous ne prenons pas immédiatement des mesures pour ralentir la propagation de la maladie. Les zones 1 et 2, qui s'étendent de Sackville jusqu'à l'île Campobello, sont maintenant dans la phase alerte orange du plan de rétablissement. Pour que ces zones puissent retourner dans la phase d'alerte jaune et que toute la province puisse y demeurer, la population doit s'engager encore une fois à ralentir la propagation de la COVID-19 et elle doit s'engager immédiatement. We are facing a serious situation with the renewed transmission of the virus in New Brunswick. And honestly, I know this is a direct relationship between what's happening in our province and what's happening across the country and other jurisdictions in terms of the record number of increasing cases across Canada, in the US, globally, and the UK and Europe. So our situation can turn quickly very serious if we do not take immediate actions to slow the spread of this disease. Zone 1 and Zone 2, an area that spans from Sackville to Campobello Island, are now in the orange phase of recovery. To bring them back into the yellow phase and keep the rest of the province at that level, we need a renewed commitment to that, to slowing the spread of COVID-19, and we need it now. Everyone needs to reduce their close contacts to the lowest number possible. I can assure you that the people who are transmitting COVID are not aware they're transmitting COVID. I can assure you that the people who are being infected with COVID-19 are not aware that they're being infected with COVID-19. It is a very subtle and very discouraging type of virus and transmission because it is silent. We don't know what's happening. But it is happening, and once it happens, it is very hard to get under control without the cooperation of everybody, every single citizen doing their part. Everyone needs to wear a mask when in public. Even if you are 2 feet apart, great, but you still have to wear your mask at all times. And don't think that you have an elevated level of safety by being closer than 2 feet apart while you're wearing a mask and not being susceptible to COVID. That's not true. Just because you have a mask on does not mean you can get closer to people. You have to observe physical distancing with others at all time, no matter where you are, no matter who you're with. Everyone needs to strictly isolate themselves when directed to do so. We can't go on as if our case numbers were still low. That's not possible. They are not low anymore, and there is a significant risk that they will climb higher in the days to come. And again, we have our triggers. We have our 3 categories of triggers. We have the epidemiological data in terms of the case number of transmission, of the type of transmission of cases, the number of cases, how fast they're increasing, whether there's community transmission or not. That's one of the categories. The other categories is the public health work in contact tracing, and the compliance and cooperation of the citizens responding and complying with public health measures. The other piece of this in terms of our triggers include the hospital capacity, hospital human resource capacity, as well as beds, and also the capacity to continue to provide healthcare services for the population. So we are looking at all of these triggers very, very carefully, and that is why we're in the orange phase of recovery right now in Zone 1 and in Zone 2. Les nouveaux cas, aujourd'hui, il y a 23 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Il s'agit du nombre le plus élevé de cas enregistrés par Santé publique en un seul jour depuis le début de la pandémie en mars dernier. Et comme je viens de vous dire, c'est des nombres records de plusieurs cas au Canada maintenant. Alors nous, ici au Nouveau-Brunswick, c'est le record de le plus grand nombre de cas annoncés dans un jour. Les nouveaux cas sont les suivants. Dans la zone 2, qui comprend les comtés de Saint John, de Kings et de Charlotte, 16 cas, dont 2 personnes âgées de moins de 19 ans, 3 personnes âgées de 20 à 29 ans, 1 personne âgée de 30 à 39 ans, 5 personnes âgées de 40 à 49 ans, 2 personnes âgées de 50 à 59 ans, 1 personne âgée de 60 à 69 ans, 2 personnes âgées de 80 à 89 ans. Dans la zone 1, soit la région de Moncton, 6 cas, dont 1 personne de moins de 19 ans, 1 personne âgée de 20 à 29 ans, 3 personnes âgées de 30 à 39 ans, 1 personne âgée de 60 à 69 ans. Dans la zone 3, la région de Fredericton et du centre du Nouveau-Brunswick, 1 cas, 1 personne âgée de 30 à 39 ans. Today, there are 23 new cases of COVID-19 in New Brunswick. That is the greatest number of cases public health has reported in a single day since the COVID-19 pandemic was declared last March. And as I mentioned earlier, what we're seeing across the country, what we're seeing in the US, in Maine, and also in parts of Europe and the UK, and globally, daily numbers of record-breaking cases announced every day, record-breaking number of deaths every day. This is a worldwide issue right now that New Brunswick is not immune to. The cases are as follows. In Zone 2, which is the Saint John, Kings, and Charlotte County areas, there are 16 cases. 2 individuals under the age of 19, 3 aged 20 to 29, 1 aged 30 to 39, 5 aged 40 to 49, 2 aged 50 to 59, 1 aged 60 to 69, and 2 aged 80 to 89. In Zone 1, which is the Moncton region, there are 6 new cases, 1 under the age of 19, 1 aged 20 to 29, 3 aged 30 to 39, and 1 aged 60 to 69. In Zone 3, which is Fredericton and Central New Brunswick, 1 case, an individual aged 30 to 39. There are now 71 active cases in New Brunswick, with 1 individual in hospital. And I ask that you keep these fellow New Brunswickers in your thoughts and prayers today, as well as the very large number of people who are self-isolating at home for the next 14 days, worrying and wondering if they are going to become COVID-19 positive as well. We are closely monitoring the situation at the Shannock's Parkland Adult Residential Facility in Saint John, where 1 case of COVID-19 was reported this week. Yesterday, 421 tests were administered and 3 new cases of COVID-19, all in the same area as the original exposure. So further processing and analysis will continue today. This facility has single rooms and a separate wing for Alzheimer's patients, which is helpful in slowing the spread of the disease. We are continuing to test all residents and staff at the complex and are taking all other necessary steps to prevent further spread of COVID-19 among the residents. Il ne faut pas oublier que les cas que nous signalons aujourd'hui découlent d'infections qui peuvent remonter à jusqu'à 2 semaines. Même si nous changeons tous immédiatement nos comportements, il est possible que nous ne voyions pas les résultats réels de nos efforts avant 2 semaines. Il est toutefois très important de changer nos comportements dès que maintenant pour que nous puissions endiguer la vague montante de la COVID-19. Je vous demande donc de rester à la maison le plus que possible. Ce n'est pas le moment de se rassembler en famille et lors des fêtes à la maison. C'est très, très, très important de suivre les directions maintenant de la santé publique. On a vu dans l'éclosion à zone 5, ça a pris 4 semaines pour gérer la situation. La dernière éclosion dans la zone 1, ça a pris 2 semaines à gérer la situation. Alors moi, je dirais que c'est un minimum de 2 semaines, mais ça, c'est si tous les comportements changent aujourd'hui. Et je sais qu'il y a des gens qui ne comprennent pas encore comment sérieux le problème est, et c'est concernant. C'est vraiment concernant quand j'entends qu'il y a encore des gens qui planifient des rassemblements. C'est pas une bonne idée. Le risque est trop élevé à ce moment-ci. It's important to remember that the cases we are reporting today are the result of infections that happened up to 2 weeks ago. Even if we all change our behaviors immediately, we may not see the full result of our efforts for another 2 weeks. The outbreak up in Zone 5 took 4 weeks to get under control. The last outbreak in Zone 1 took 2 weeks to get under control. But it is very, very important that everybody changes their behaviors immediately so that we can stem the tide of COVID-19 that is now on the rise. So please stay home as much as you possibly can. This is not the time for family and friends to gather or to have house parties or to have any gatherings with your colleagues. This is not the time. And I have heard of people organizing gatherings for many different types of situations. It is a very bad idea. The risks are way too high right now. If you are asked to self-isolate, please do so immediately. Don't make any last trips to the grocery store or to the pharmacy. Ask a neighbor or a family member to do your errands for you. Make a contingency plan now so that you are ready if you need to self-isolate, just like EMO announces when there's going to be a power outage. Please have your 72 hours of supplies ready. Have your 14-day plan ready right now if you have to self-isolate for COVID-19. Above all, keep in mind that this virus will spread quickly if we give it a chance at all. And when I say spread quickly, it's a doubling time. It can be 24 hours, 48 hours, and within a week we can be in very, very high numbers that are very difficult to manage from a healthcare system perspective. Don't take risks. Remember that you have the ability to protect yourself and your family and your community from COVID-19. I just have to say a big thank you to those people who have been following public health directions from the beginning of the pandemic. It has been a very difficult journey for all of us, but I am so grateful for the cooperation of the entire province, individual citizens, communities, leaders. I work with a fantastic group of people in public health. I cannot tell you how inspiring it is to see people who are so, so dedicated to protecting the health of the entire population of New Brunswick. We are having meetings constantly, assessing the risks, assessing the management of those risks, preparing recommendations for government, et cetera. This does not stop. This work is constant, and I'm so grateful for the leadership that I'm seeing, not only with the Pandemic Task Force, but also with the COVID-19 Cabinet Committee. We are different from other communities and jurisdictions. I get asked all the time, how come we are succeeding in the Atlantic Canada? How come the Atlantic bubble is succeeding? And I can tell you that the success that we have seen is a collaborative and collective effort, and we can all take pride in that success that we've achieved thus far, knowing we have a long way to go until there's a vaccine, knowing we have a long way to go until everybody is vaccinated in this province. But to date, we have had an extraordinary amount of collaboration and support and work that has been done. Let us stay the course and keep doing what we've been doing. Si nous acceptons la réalité de la situation et nous engageons à travailler ensemble, je suis convaincue que nous pouvons endiguer la vague. Thank you very much.
Good afternoon, bonjour. The rising number of active COVID-19 cases clearly highlights that our province is extremely vulnerable. I know we are all disappointed by this development. What we're seeing today is the result of actions made days ago. What we will see in the next few days is the result of actions taken days ago. We know what we need to do to turn this around. The mechanics of what we are being asked to do are not difficult. wear a face mask, maintain a 2-meter physical distance from others. Don't gather in groups. If you're sick, stay home and away from others. These are simple actions, and they have been proven to make a difference. We think it's simple. You know the rules, so start following them. We know most are complying in public places, but some are letting their guard down, and this is leading to the situations we are in. But it's not too late. We understand that we are human and want to be together, but we have to remember these are rules to keep us all safe. We have been the envy of the world, but we're at a real risk of losing that. People know what is being asked of them, and we need to support all of those who are making the effort. Law enforcement officers are out across the province, not just in the orange zones where people are putting others at risk. We can still turn this around. To do so, we must work together and we must follow the rules. To do so, we must care for one another. If someone or a business is not following the rules, you can call the toll-free information line at 1-844-462-8387 or email helpaid@gnb.ca. No one wants to be separated from their family, including me. Currently, residents in both Zone 1, the Moncton region, and Zone 2, the Saint John region, are in orange. But make no mistake, the other regions of the province are at risk. We all want to stay in yellow alert level, but the actions of people are taking are pushing us closer and closer to orange, and in some cases, closer to red. If we don't change our behaviors and our actions today, right this minute, that is where we are headed as a province. Imagine if our cases double daily, as is happening in Quebec. 23 new cases today would be 46 by tomorrow. If this happens, it will be a very short period of time until we are seeing hundreds of new cases daily. Our healthcare system will be completely overwhelmed, as we are seeing happening in other provinces. We did well for so long. Let's show the world that we achieved what we did for as long as we did, not because we are a relatively small rural province, but because we are New Brunswickers and we care about one another. Now is the time to show that we are driven by what is truly important, that we value not just ourselves and the people we love, but our greater community. We are truly all in this together. North, south, east, west, central New Brunswick, we are all connected in the ways that matter most. Now that there is a light at the end of the tunnel, the possibility of a vaccine, we must not falter. Now is the time to dig deep, to remember why we are being careful, why we are following these simple rules. We are doing this to keep each other safe and healthy. We are doing this to save lives. Thank you. Merci.
Good afternoon. Bonjour. I'm asking, please don't give up now. Je demande, n'abandonnez pas maintenant. You've heard from Dr. Russell. You've heard from our Minister of Health, Dorothy Shephard. We are now in our own bubble in New Brunswick, and that bubble is about to burst. So we've had great success as an Atlantic region. We've had great success as a province in working together to lead the nation in protecting each other against this virus. People around this province have worked so hard. It makes me really sad to think we could lose our gains at the very last minute. Les gens de tous les coins de la province ont travaillé si fort. Je suis attristé par la possibilité que nous perdions notre longueur d'avance à la dernière minute. As Premier, it's been a humbling exercise to be part of a world pandemic and to be such a leading part of it with the great people in this province. Not only people that have worked tirelessly in every sector to guard our borders, to protect our health system, to do the testing, but people who have paid attention to the public health rules and have taken that extra step just to be sure. And now we're at a point where being sure and being careful and being secure is very much at risk. We've had a sense of pride in New Brunswick, I would say, that we haven't had for generations. We've had a sense of pride nationally. People have looked at New Brunswick. I've said it many times, looked at New Brunswick again for the first time. What's going on in New Brunswick? We've seen people start to move back home. We've seen people start to move here for the first time, buying properties, investing in businesses, looking at how we're managing not only the pandemic, but how we're learning to live with it and grow with it and move beyond. We've seen unprecedented working cooperation in our two linguistic communities, particularly in the health field between Vitality and Arising, setting standards of performance that have never been seen before in our province or haven't been seen for generations. And I'm so excited about that possibility and the potential that our province is on the cusp to achieving and moving beyond. I don't want to shut down businesses. I don't want to see us move back. We said from the beginning of this pandemic and when our hard closures happened back in March and April, we didn't want to go back. But the situation we're now seeing in two southern zones is putting us very much in that area, particularly in the Saint John zone. We've seen activities that defy logic in face of a pandemic. We've seen undue care and attention, caution thrown to the wind, and basically thinking it doesn't exist here in New Brunswick. This is indeed a reality check. It does exist. The stories, the newscasts, everything we're hearing worldwide, everything we're hearing nationally from other provinces is real. We've said here time and time again that the potential is that it will come to New Brunswick. We're seeing it. It is arriving now in the second wave in real terms. We've been successful in fighting that back in the Northern Province, in the Campbellton region, a couple times, and in the Moncton region back a few weeks ago, only in the orange phase for 2 weeks. The Moncton region has that potential to carry on in that fashion, and hopefully perseverance will prevail and we will get back to normal there quickly. However, the threat we have in front of us right now is the entire province could go to orange phase. So we're not talking about a zone. We're talking about all zones everywhere. And right now, the Saint John region is in that very, very precarious position with the cases maximizing and increasing so much. So I'm asking today, before we're forced to go into business closures, we are going to be doing a lot of work, surveilling, going around to different businesses, going around and checking for compliance. And we are issuing tickets. We will shut down businesses that are not compliant. I don't want this to be a blanket approach, which would be the case if we have to switch back and go into a zone red. But we will be enforcing the rules, but we're asking business owners, we're asking patrons to follow the rules. If people come in your establishment and they don't want to follow the rules, ask them to leave. We can help you have them leave if they choose to be defiant. This is no time to lose patience. This is no time for us to regress on such a positive situation that we have found our province in. We do indeed have an opportunity here. We have led the nation in the way that we've managed this together. We can continue to do that, and now is not the time to give up. Il s'agit d'une occasion pour nous. Nous avons été un chef de file à l'échelle nationale en raison de notre gestion de la pandémie. Nous pouvons continuer à servir d'exemple pour le reste du pays. Ce n'est pas le moment d'abandonner la lutte. I'm asking each and every citizen of this province to once again set the standard nationally. Let's really focus in these coming weeks, these coming months. A vaccine is so near. We've heard about it. Wouldn't it be a shame to be this close to the finish line with a record that is an envy of the world, of the nation and of the world, and to lose it in the final sprint? Let's stay focused. Let's be ready for the vaccine, but let's be the ones that have learned to live in COVID like no one else and set the standards for our entire country. Thank you. Merci.
Merci beaucoup, Monsieur Premier Ministre, Dr. Russell. Thank you, Premier, Minister, and Dr. Russell. We'll now proceed with questions from members of the media. You have the right to pose your question in the language of your choice. Each reporter will have one question and a quick follow-up. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de vos choix. Chaque journaliste peut poser une question puis un suivi. Silas Brown, Global.
Good afternoon. This is for Premier Higgs. We're being asked not to gather, and we're being asked to keep our contacts as tight as possible at this point. But non-essential businesses are still allowed to operate across the province. Weddings are still able to happen. Funerals, church services. Is that contradictory to New Brunswickers at some level, that we're being asked not to gather, but we are still permitted to gather in many different scenarios?
Hi, Silas. I'm going to take that question for the Premier. So each and every time we go through our public health measures in terms of what we need to do to manage the risks of COVID-19, we come with our team of epidemiologists, our medical officers. We look at the evidence-based information around the risks around different types of things, and we look at the data in our province, and we have been doing that throughout the entire pandemic. And what we know from early days is that an entire province-wide shutdown has very, very, very serious impacts on the economy, on people's mental health, physical health. The healthcare system itself has now a huge backlog of services and surgeries, et cetera, that were not available during that time and will take a long, long time to catch up with. So first and foremost, we know that that worked in terms of managing the cases of COVID at that time to not overwhelm our province and our healthcare system, but the costs were very, very high. So as we move through the pandemic, and this is an evolving situation, we take all the new evidence-based information, we take our data, and we make our best risk assessment based on what we know we need to do to keep our economy open, to allow essential things to happen, at the same time knowing that there are some mental health issues around people not being able to have ceremonies, et cetera. So there is a value component to put on that in terms of managing that. And at the end of the day, we do want people to be able to have an opportunity to continue to experience the things they need to with respect to healthcare service delivery without being overwhelmed with COVID. I watched a tearful delivery from the medical officer of health in charge of the Ottawa area, and she was in tears talking about the fact that their healthcare system is so overwhelmed. People are now dying of non-COVID illnesses because they can't be treated, because there are too many people in the hospital with COVID. Ultimately, that is what we have to avoid happening, ultimately. We want to be able to avoid having that happen while protecting people's mental health, while protecting the economy, while protecting the school system and education of children. These are all the things that we need to try to balance, and while it may be hard for the public to understand or comprehend in terms of, how are we supposed to balance all of these things and how are we supposed to live like this, I am just asking you all, we have come so far. We have done so much hard work together. let's continue and stay the course, and honestly, we will keep looking at the data and keep revising it as we see fit in terms of all the new information we get. We, in fact, since the last outbreak in Zone 5, we've made some changes, and again, we're trying to get better and better and better with each outbreak, and I believe we have been getting better and better with each outbreak. So if we are all staying the course, hopefully the Zone 1 and the Zone 2 outbreaks will be able to be managed quite quickly with the dedicated resources that we have that are working so hard. And again, there's so many people that are cooperating right now. We have so many partners engaged in discussions. We have so many leaders that are pulling together to make sure that we can keep the public informed with the up-to-date, transparent information that they all need to make good choices on an individual level that have an impact on their entire community and indeed the entire province.
Mr. Brown, do you have a follow-up?
Yes, I do. Of course, Dr. Russell, the priority here is to ensure that the healthcare system isn't overwhelmed, as you mentioned. But when we see spikes like this that have not shown signs of slowing down over the last couple of days, at what point do you say that this isn't working anymore? And can you really tell New Brunswickers at this point that the things that are being done to ensure that the healthcare system isn't overwhelmed, as you say, are actually working?
That is a very good question, Silas, and I am happy to elaborate on what our triggers are and have been throughout the pandemic. And again, I am really grateful for our team of epidemiologists and medical officers who go through this data with a fine-tooth comb. We work with our RHA partners to make sure that the healthcare capacity is there. So at this moment in time, as Minister Shephard mentioned, the doubling time of the cases is quite concerning. So once we have 23 new cases, and if that gets bumped up to 46, let's round it up to 50 because the math is easier, as I mentioned the other day. So if that then goes to 100, and then that goes to 200, and then that goes to 400, quickly this can go completely out of control. And from a numbers game, the percentages of people that we know out of a number of cases of 400, there would be 20% of that 400 who would be very ill, and 15% of those would need hospitalization, and 5% of those would need ICU beds, and then a certain percentage of them would pass away depending on the age group, group that we're talking about in terms of who's affected. So as those kind of numbers can creep up so quickly, that is why, from an evidence-based perspective, we know that it's important to go early with our approach and all of the protocols that we need to put in place. And it's in that way we can stay, we can keep the outbreak short and go back to the yellow phase really quickly if all goes well, if everybody cooperates. So we are confident that the things that we're putting in place are going to work because that's what we've been doing throughout the pandemic. Again, when we got the Zone 5 outbreak under control, decisive information in terms of making a decision based on the triggers, put the triggers in place, watched and waited for signs of improvement, didn't see what we wanted right away, added some more measures in terms of wider communication with leadership, public engagement, and media. We will do whatever it takes to get these outbreaks under control based on the evidence and based on the data. That's what happened in the last outbreak in Zone 1 as well. So we're using the same approach with each and every outbreak, and as I said earlier, we're getting better and better each time in terms of understanding how to target our approach in terms of managing the risks, so that we're only aiming. It's like instead of in the first wave when everything was in the red phase and lockdown, it was like dropping a big bomb everywhere and kind of wiping everything out just to sort of get through that phase. We want to be much, much more targeted in our approach right now to do the things that we know will help immediately, that we know will help get us back into the yellow phase as soon as possible, and that is our goal.
Jay.
Yes, hi. I'm wondering about what we know about the spread in the Saint John region. On the provincial dashboard, it's difficult to track which cases are community transmission, which are travel-related, whatever it is. And so with a number of cases resulting from public exposures at businesses last weekend, I'm just wondering what the status is of that spread. Have we discovered chains of transmission extending from those exposures?
Well, I talk to my epidemiologists and medical officers every day, and what our understanding is right now is that all of the cases can be traced back to the original index cases. So any of the clusters that we're seeing in the Saint John area right now can be traced back to their index cases for those clusters. With respect to the transmission in public areas, again, time will tell around who will be showing up positive. We are making sure that people have access to testing. So of the people who have tested positive right now and their close contacts, they're all self-isolating right now. For those people who may have been exposed, again, we have great capacity to test. So whether it's the online assessment form or whether it's 811, anybody who is symptomatic can go get tested. We wouldn't be keen for people to be tested who don't have symptoms, in the sense that that might give them a false sense of security. So we do want people to monitor for symptoms, and if you do have symptoms, get tested right away, self-isolate right away. And we do encourage people to get the COVID app. This is very helpful. The more people that get it, the better it works, obviously. So we do need a lot of cooperation right now in this region in terms of not having any essential travel into and out of the zones that are affected right now in the orange phase. And we are looking for everybody's cooperation to continue to follow the public health guidance right now. And again, not take anything for granted. I think there is a bit of being a victim of our own success by keeping the COVID numbers so low as long as we have, that it makes people have a false sense of security and that they don't have COVID and they're not transmitting it to other people, but it is happening. And in fact, there's community transmission in Halifax right now, and I am aware of situations where people have gone to Halifax and gotten exposed and infected, did not know they were infected, and brought it back to their own jurisdictions without even knowing. So these are the types of behaviors and activities that people need to be aware of, that you cannot even know you're being exposed, and you cannot even know that you're exposing other people and infecting other people.
Thank you, Doctor.
And so,
A follow-up,
What-
Mr. Burnett?
thank you. Yes. When was the last case of community transmission discovered in the province then? And are we investigating possible community transmission now?
So, we thought there were 5 unlinked chains of community transmission at the beginning of the Zone 5 outbreak, and that was very concerning. At the beginning there were fewer unlinked chains, but by the end of that 4-week period, with all of the multiple investigating and interviews that the public health nurses did, we were able to track down the links for every single one of those, with the exception of the index case, who unfortunately had passed away before we could interview and get all that information. So really and truly, we have been quite successful. So it would probably be before any of those most recent outbreaks. I'm trying to remember if there was an index case that was related. Yes. So as of right now, if there are any under investigation, they will remain under investigation until we find those links. But we have been quite successful at eventually finding those links. So I'm not saying there's community transmission at this moment in time, but certainly with the public exposures, as long as people are aware that if you have mild symptoms, get tested. We know that the transmission patterns in the last outbreaks that we've had have involved people going out and about, whether it's a workplace or a gathering, with symptoms, without a mask, and then infecting others, not knowing that they had COVID because they didn't get tested. So we want people to be very confident, have a low threshold to get tested, and that's how you're going to protect your community, that's how you're going to protect your family, your colleagues, and in fact, the entire province.
Thank you, Mr. Burnett. Thank you, Doctor. Sarah Seeley, Times and Transcript.
My question is Premier Higgs. I was just wondering what the province is doing for businesses in the orange zones that are going to be struggling during the Christmas season, especially restaurants and retailers.
I think the very reason we try so hard to keep businesses open is to allow them to be able to take advantage of the season and the additional activities that happen during this time of year. Also to ensure that the rules are all followed, and to encourage people to continue to do that. That's why we have tried so hard, and we'll continue to try so hard to keep businesses open, because we believe their biggest opportunity for success is to keep the doors open. Having said that, the ones that do stay open through this orange phase are going to need to follow the rules. And as I said earlier, We will enforce the rules because we must. But I'm confident that the businesses will see an upswing. We've asked local citizens certainly to support businesses, even though the balance is between, going out to shop or experiencing that, but doing it safely. And I'm confident we can do that. So right now, our goal is to keep the doors open and allow businesses to continue to be in business. If we have to go further, then we'll discuss how that might work in terms of the impact and the financial situation of each establishment.
Thank you, Premier. Ms. Seeley, do you have a follow-up?
Yes, I was also wondering how gatherings like house parties and other public gatherings are being enforced by law enforcement.
I guess if you see 20 cars outside of a dwelling, then that's the first clue. Because we have asked very seriously that we want people to stay within their household bubble, and that's extremely important. These house parties, and I've heard of invitations have gone out to join us for a Christmas special here and there, and people have declined. Well, I'm saying to those folks, thank you for declining, and I'm saying to those folks that sent the invitation to begin with, please think about what you're asking. I know you want to be social. I know you want to encourage a gathering with friends and neighbors, but find a way to do it online this year. It is a new time. And as you've heard so many times, and as I've seen other communications where we're asking people to just be thankful for what we have in our province at this point in time. Look around us. Let's not take what we have for granted. Let's not let our success to date be lost. So if a household has 20 cars out front, they better be vacant cars because we need to confirm why they're all there.
Thank you, Premier. Thank you, Ms. Seeley. Alexander Silverman, CBC.
Yes, I have a question for Dr. Russell. What more can you tell us about the super spreader event you mentioned yesterday?
Well, what I can say is that it is only one of many contributing factors to the outbreaks that we're seeing right now. So as we saw in the outbreak in Zone 5, the major drivers of transmission, and this still continues to be the case, are small gatherings with family and friends or colleagues. Whether it's one event or whether it's several concurrent events with many different people being exposed, the number of close contacts that you have is critical. So the lower your number of close contacts, the better chance we have at success at getting these outbreaks under control, period. So whether there's one person who goes to many events or whether there's one event that many people go to, either way, people have too many close contacts. Sometimes there are informal gatherings, again, with family, with friends, with colleagues, and it could be many small gatherings or one large gathering. And again, it's very innocent because people don't keep track. So, and again, I've mentioned this before, that the contact tracers, when they speak to the people who have tested positive for COVID to do the contact tracing, people say, I haven't been very many places, I haven't seen very many people, but then when they sit down and they actually record the number of places they've been and the people who they've been with without wearing a mask and being within 2 meters or 6 feet, the number is very surprising, and the people are quite surprised and amazed, like, wow, I had no idea that I saw 20 or 30 or 40 people in the span of the last several days. But it is happening, and that's what we're seeing. So we need people to really, really clamp down on the number of people that they see indoors without a mask, within 6 feet of each other. It's quite a conscious decision. We're wearing masks in here. We take them off when we come up to the podium. So when you are interacting with any individual, I have said it before, that you have to act like you have COVID. The community transmission that we're seeing in Halifax and the person who took it to another jurisdiction, again, they did not have their mask on. They were not aware that they were congregating with people who had COVID, and then they did not know they were infected with COVID, and they went back to their jurisdiction and then infected other people because they didn't know that they were infected with COVID, and the people they were interacting with did not know they were infected with COVID. We don't know who's infected with COVID until after it's too late and it's already transmitted. That's why everybody has to wear their masks all the time. That is why everybody has to stay 6 feet apart all the time. You have to make a very conscious choice and a very conscious effort to keep COVID from spreading. we can only do so much at our end, and we are doing everything we can. And coming back to the question I had about, the measures that we're taking, and are they balanced with the consequences and the risks? From a public health perspective, we always keep in mind the social determinants of health, which include mental health, which include income, which includes the economy, which includes all of these different things, including healthcare. So we don't look at it just as we're going to try to control COVID. We are trying to control COVID by keeping in mind all of the social determinants of health that we know we have to balance to be able to have a functioning society, to be able to have a functioning economy. So these are very, very important things that we take into account when we're communicating all of this information to people so that they can really understand what it is they each need to do to protect themselves, their loved ones, their community, and the entire province and our healthcare system.
Thank you, Dr. Mr. Silberman, do you have a follow-up?
Yes, Dr. Russell, what can you tell us exactly about where the super spreader event happened, or perhaps how this might have contributed to the rise in cases in the Saint John region?
Well, again, I don't really want to focus on any one event because there are so many contributing factors to the spread. In the Zone 5 outbreak and the Zone 1 outbreak previously, some of the spread was between colleagues in workplaces who were not physically distanced and were not wearing masks. We are still continuing to see transmission in those settings too. So super spreaders and super spreader events are one component, but it's not the whole picture. We have to keep in mind that there are many group settings and gatherings that we're seeing all over the province right now. And so when we talk about, the whole entire province is at risk, that is very true because the zones that are in the yellow phase right now probably have lots of people who are gathering with large numbers of people or multiple small gatherings, which add up to a large number of close contacts. So the message is, keep your number of close contacts low. Be very judicious about where you are and when you make decisions about participating in any gathering, whether you're going to keep your mask on and stay 6 feet apart, number one, if it's indoors versus outdoors. There are a lot of decisions to make every day when we get up in the morning, but whether or not you might have COVID and you might transmit it to somebody else is probably the first and foremost thing on your mind. Or it should be if it's not.
Mr. Silberman, thank you, Dr. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is either for Dr. Russell or Premier Higgs. When Zone 5 rolled back to the orange level, exemptions were made for some communities that were not affected by the outbreak. Are you considering or would you consider carving out exemptions in Zone 2 for areas that are less affected, or is there a reason why the entire zone is rolling back at once?
At this time, wouldn't be a consideration to separate. We really haven't done that much to this point. I know there was some consideration up in the north in some areas. So at this stage, we're very focused on saying, look, we have two zones in orange, and we could be in a situation where we're seeing orange start to happen all over the province. So right now, the zones that we're talking about in the Saint John region and Moncton region are what they are, and we're going to continue to be in that for the entire region. And let's get this under control before we look at any carve-outs.
Do you have a follow-up?
Yes, just a quick follow-up. If the zone remains in orange level for an extended period of time, would you consider carving out exemptions in the future for certain areas that might prove to be stable?
The Minister of Health is going to talk about that in specific terms, but I just would reinforce right now we need to focus on getting under control what the situation we're in today.
Thank you, Premier. I want to speak to this just because it's really easy to ask to be exempted, and people want to be exempted. But the fact of the matter is areas that are still maybe at arm's length from a zone that is under a particular phase, whether it's orange or red, services are still accessed in those more urban areas. And so even though you want to be exempt, you're still part of the community, and we're not going to be issuing exemptions at request. It is really important to know that we are all in this together. And if your zone is a particular phase, we need you to help be part of the solution.
Thank you, Ms. Hogarth.
Thank you.
Rose Saint-Pierre, Radio-Canada.
Merci, Bruce. Ma question est pour Dr. Russell. J'aimerais avoir des détails sur la transmission du virus en ce moment pour les zones de Moncton et de Saint John.
Qu'est-ce qu'on voit pour la transmission, c'est pas tellement différent des d'autres éclosions au niveau de les gens qui ont un nombre trop haut de nombre de contacts étroits, numéro 1. Et les rassemblements, ça contribue aussi. Alors, ça n'a pas changé des autres éclosions, sauf que le nombre de cas augmente très, très, très vite et c'est très nombreux, les gens qui ont eu des contacts étroits et après ça, leurs contacts étroits, les gens qui sont devenus positifs pour le COVID-19. Alors, à ce moment-ci, la seule manière qu'on peut gérer la situation, c'est de continuer à contacter les contacts étroits avec les nouveaux cas chaque jour et on va surveiller la situation. Et si les gens peuvent respecter les directions de santé publique, on va voir que peut-être entre 2 semaines ou 4 semaines, on pourrait vraiment gérer la situation dans les 2 zones. Mais ça reste à voir à quoi la population va décider sur les décisions sur les contacts étroits et qui va continuer à avoir des rassemblements, etc. Parce que je sais, c'est difficile à dire non. J'aimerais que ça soit très facile pour les gens à dire non. Je ne veux pas participer à ce rassemblement, soit avec la famille, soit avec mes collègues, soit avec les amis. C'est pas quelque chose que j'encourage les gens de faire à ce moment-ci parce que les rassemblements ont un risque élevé à ce moment-ci. On voit les cas élevés dans le reste du Canada, dans d'autres provinces. C'est des records nombres de cas. Les hôpitaux dans les autres provinces sont vraiment pas capables à gérer la situation. Et ça veut dire que s'il y a trop de patients avec le COVID-19, ça veut dire que les gens qui ont des autres maladies ne peuvent pas se faire traiter et on va avoir plus de décès pour des situations et des maladies qui ne sont pas même liées au COVID-19.
Merci, docteur. Mademoiselle Saint-Pierre, as-tu un suivi?
Oui, je voudrais savoir si les indications pour les visites dans les hôpitaux et les foyers de soins vont changer.
Dans les zones oranges?
Dans les zones oranges.
Ben, je crois qu'il y a déjà des directives et protocoles pour les visites dans les zones oranges déjà. Et ça devrait être quelque chose qui est facile à trouver en niveau de détail. Je crois qu'il n'y a pas de visite dans les zones oranges durant ce temps.
RHAs have the process and so does...
Social development?
Yep.
OK. Alors, ce serait les réseaux Vitalité puis Horizon et aussi Développement social qui aura les directives et les protocoles sur les visites à ce moment-ci dans les zones oranges.
Merci, Mademoiselle Saint-Pierre. Sarah Smelly, Canadian Press. Sarah Smelly, Canadian Press. That concludes today's update. Thank you very much. Cela conclut les séances d'aujourd'hui. Merci beaucoup, tout le monde.